Hello everyone, it is Sunday, March 29th. Wanted to share a little bit of an update about what's going on in Sonoma County with respect to COVID-19. So starting out with the basic information, we currently have 58 total cases, positive tests of COVID-19 in Sonoma County. Of those 58, 44 of the cases are active, 13 are recovered. We did have one fatality, and we have conducted 1,397 tests. So it's good. I at least feel a little bit better knowing that those test numbers continue to climb. We are looking at more proactive testing. The shortage continues to be in the swabs, which are used to actually take those tests to get the samples that are then sent over to the public health lab or to LabCorp or Quest if they're being tested on the private side. I wanted to provide with a little bit of demographic information about the current positive cases in Sonoma County. I feel a lot better, honestly, being able to provide this information to you. This was not allowed to be shared until we hit 50 in order to abide by patient confidentiality. So a little bit of demographic information in terms of the age ranges of the patients. 28 of the 58 fell into the age range of 18 through 49. 20 people fell in the 50 through 64 demographic, and there were 10 people who were 65 or older. In terms of the geographic spread, we are seeing coronavirus throughout the county. There is neither a safe area of the county, nor is there a particular hotspot. So 7 in North County, 10 in South County, 9 in East County, 9 in West County, and then 18 in Central County. And while the 18 sounds higher, you have to remember that the greatest concentration of population in Sonoma County is also in Central Sonoma County. So that explains having a little bit of a higher rate there. We are at about 22% hospitalization rate out of those, and that's cumulative, not currently in the hospital. So don't go out there thinking that there are 22% currently in the hospital. That's just over time. So 78% have not been hospitalized. Right now, in terms of gender, we are actually dead even. It's 50-50 male and female. I also wanted to provide a couple of updates. The Board of Supervisors is not meeting this week, but we will be meeting next Tuesday, April 7th, so the following week. And at that board meeting, we will actually be considering a couple of emergency relief measures that our tax collector, Eric Rozier, is bringing forward. It's not property tax deferral. I know a lot of people have been asking about that. More on that to come. He will be providing an update about that, and I think conversations about what could be potentially a penalty waiver for those who are suffering economic hardships, but it's not an actual delay of the deadline. However, it will be a delay of the tax deadline for those businesses who normally pay transient occupancy tax, the hotel bed tax. We recognize that our motels and hotels have been very, very hard hit because of the shelter-in-place order, and so just as we did in prior disasters, we will be allowing them to defer their payments out for a couple of months. Same thing actually for our cannabis businesses. We will also be giving them an extension of the tax deadline. You know, I want to address something that happened today that you might have read about on social media or you might have read about in the Press Democrat, and that's that our Director of Emergency Management spent yesterday out at the beach with his family. And those that actually was posted on social media, pictures of him doing this, and it came to my attention when a Sonoma County resident emailed a screenshot of the social media post and sort of let us know that that was happening, and also notified not only the entire Board of Supervisors, but also the local media. This was really disappointing to me. And it's disappointing, I mean, first of all, no one's perfect, right? We all make mistakes. But in this era of a pandemic, our entire social fabric and our entire public health is relying on our ability to follow rules as a community, right? And I want to say that having the parks closed is absolutely horrible. It's really challenging on everybody, whether you are, you know, a high up, sort of highly powerful government official, whether you're an elected official, whether you are just a mom trying to deal with the giant mess that is your house as you learn to homeschool your kids for the first time, whether you're a single person who is out of work and not sure how you're going to pay rent or pay the bills. This is really challenging. We all love getting out into our parks. We all love getting out to the ocean. But it's critical that we follow the rules because that is what is in the best interest of our public health right now. And so it's very disappointing when you see someone in a leadership role not following the rules, because I feel like it's incumbent upon us to set a good example and to actually follow the rules, follow shelter in place, abide by the park closures. So I was very disappointed to see that. That said, our director of emergency management, everybody makes mistakes, and he has served our county well. So I don't want to make this about demonizing someone or villainizing someone, just owning up to the fact that we have to do better as leaders. We need to set an example, and we need to do what's right, because if we're expecting the rest of the community to follow the rules, we can't act like we're above the rules. All right, that's enough. But what I want to talk about now is whatever you want to talk about. So let's see what questions we have, and I'm happy to answer them to the best of my ability this evening. I'm going to look to my husband and see if he has been able to get any questions.
Can Santa Rosa ban reusable grocery bags to protect the grocery store workers?
Question, can Santa Rosa ban reusable grocery bags in order to protect the workers? I have heard of some grocery stores voluntarily actually just requesting people not bring reusable grocery bags and insisting upon using paper. I know that we all worked so hard as a community to normalize those reusable bags, and that they might present a hazard, especially to the grocery store clerks at this point in time. That's something that I'd like to follow up with our public health officer, Dr. Mason, to talk about best practices for grocery stores. And so thank you very much for bringing that up. I appreciate it, and I will definitely follow up on that one. I'm going to write it on my notepad right here. The reusable grocery bags.
Reminder, repeat the questions. What is happening with PPE?
Question is, what is happening with PPE, or personal protective equipment? That's a great question. And so we are continuing to solicit and accept donations. We are accepting both N95 masks as well as protective goggles and hospital gowns at 93 Stony Circle, Monday through Friday from 9 a.m. to 3 p.m. We are responding to anytime a hospital healthcare facility reaches out to the Emergency Operations Center. We do have PPE to provide them. I will be honest though, at the end of the day, we don't actually provide the PPE directly to the nurses and the doctors, right? We give them to the hospital, and then the hospital actually disperses them. And I have been informed by some nurses and clinicians that sometimes the healthcare facility is then choosing to ration them, or sort of determining how they feel like they should allocate them to staff. But we're trying to do from the Emergency Operations Center is to amass bulk donations, right, and then hand them over to the healthcare providers. We're also actually reaching out to a number of private corporations. Facebook has actually been giving out crazy amounts of PPE, and so we put in a request to see if they would be willing to donate to Sonoma County, since they donated to Marin. Other questions?
When can people get hand sanitizer or the ingredients to make it?
That's a great question. When can people get hand sanitizer or the ingredients to make it? And I have heard that there are a number of local distilleries. I think that Spirit Works might be one of them, that are actually manufacturing hand sanitizer locally here in Sonoma. So that's a great question, and I will also follow up and see if I can get a list and maybe send it out in our email newsletter and post it to social media of which local distilleries and businesses are actually manufacturing hand sanitizer, because I've heard of a handful that are actually doing that locally. So we should be able to get that out and onto the shelves, or maybe you can pick it up curbside, since a lot of local businesses are allowing folks to pick things up at the curb as well. Next question.
Any new insights from modeling if we're still looking at 8 to 12 more weeks of isolation?
That is a great question. So are there any more insights on modeling? And we are hoping within the next few days to actually get the first preliminary look of the data, the modeling that's being done by our modeler over in London. And so I don't have that yet, but I can promise you that as soon as we receive that information, I will make sure that that is publicly shared. We have a few different models that are being run. So looking at what it would look like without social distancing measures, with 80% of the population showing, following the social distancing order, and then also looking at lengths of time of social distancing and how that will affect our overall numbers and how close we get to the sort of, capacity of our healthcare system. So unfortunately, no modeling data yet, but I promise that it should come in the next few days, and I will share it as soon as I have it. Other questions? Oh, someone said that Griffo Distillery in Petaluma is making hand sanitizer. That's wonderful. So we've got a few different local businesses making hand sanitizer, and I will try to warehouse that information and post a list. Next question.
Jennifer Wirtz asks, have you spoken with Sheriff Essex about having deputies respond to vacation rental noncompliance?
This is a great question. So I know that we've been struggling with vacation rental compliance, and I've gotten a lot of complaints from folks, especially on the coast and the lower Russian River, that they feel like there are new people coming into their street all the time. Every couple days, vacation rentals have new faces. So I really want to work hard to make sure that businesses are in compliance with the public health order. That means that there cannot be any vacation rentals that are used for tourism purposes. And so right now, the sort of pathway forward for enforcement is actually to call the local law enforcement non-emergency number. So that would be the sheriff's non-emergency number. But I recognize that the sheriff has been a little bit overwhelmed with all of the different complaints. And so I actually had a conversation this afternoon with our Permit Sonoma director, PRMD director, Tennis Wick. And we're looking at how we can actually utilize our code enforcement capacity within the county to go after the vacation rentals as well. So that's just kind of processes starting up, but that would actually add capacity to the sheriff and help supplement those efforts. And we would actually be able to go after people proactively. So first of all, we would look at all of the folks who have permits through the county, and we could send them out notifications that if they're operating for tourism, that they're in violation. And second of all, we actually have folks who could go through and comb advertising. So if someone is posting ads, coronavirus special, come up here for a couple of weekend, and unfortunately that is actually happening right now. We could actually go after them and try to find them for what they're doing, which is not acceptable and does pose a transmission risk to our community. Next question.
Is there a viable alternative to closing almost all public space? Volunteer rangers, lottery, weekdays only to minimize visitors from elsewhere. We seem to have less access to super hard for parents, the little ones.
Yeah. This is a great question. And so this is how can we look at creating somewhere where we could actually safely enjoy the outdoors. I recognize that the closure of all of our parks countywide has been extremely hard, especially on people who feel that that's really important for their mental health and well-being, for parents who have kids cooped up in the house. And I want you to know that I am having conversations, have been having conversations actually ever since the parks closed down with our Director of Regional Parks, Bert Whitaker, as well as state parks and other park experts to think about what measures could we put in place for some kind of a soft reopening. But it was really critical that we shut down the parks in order to have that conversation and to really figure out what would be safe, what would be healthy. Does it mean that, people can only park every other parking slot? Does it mean that, there have been suggestions about looking at your license plate number and sort of odds or evens and being able to go on different days? So we are having those conversations, and, at the end of the day, public health has to be our top priority. But I do recognize that regional parks are also a critical part of our public health, just in terms of mental health, exercise, and our personal well-being. So we are having those conversations. There's nothing formal to announce yet. And I think that we're also all waiting for that modeling data to come back, and also to see if, we are really bending the curve from our social distancing measures. So, are we just continue to creep up in Sonoma County, or are we going to start to see the kinds of runaway cases that we have seen in other communities? I believe that the measures that we're taking are aggressive, and that hopefully we will not see those kinds of runaway numbers. Other questions?
I'm not sure what this is referring to. When our county office is going to be stocked with cleaning supplies to sanitize work areas and equipment?
When our county office is going to be stocked with cleaning supplies to sanitize equipment and work services? That is a great question, and actually we have been challenged in the county to secure simple disinfectant supplies. There's been really a national shortage and a run on these kinds of disinfectant products. I would have to check in with General Services, who does all of our ordering, to see where we are. I know that sort of in my office, we were going through our little stack of the bleach wipes and trying to sanitize surfaces as frequently as we possibly can. But I can definitely check into that. And if you work for the county, send me an email and I will try to make sure that your department has what it needs to be safe. So linda.hopkins@sonoma-county.org. Next question.
Can we help our young people understand they are at risk themselves? Maybe a public service announcement.
I think that this is a really good point. Someone just mentioned that how do we educate young people that they are at risk themselves? Unfortunately, we have experienced our first death in California of a youth. And as we saw from the positives, about half of the positives, not quite half, but almost half of the positives in Sonoma County are between the ages of 19 and I think it was 55. Was it 50? Got to look at this. 18 and 49. So 28 of our current positives were in the age range from 18 to 49. So I think it's really important to know that just because you're young, you are not invincible. And I do think that we need to step up our messaging around that message, right? We need to make sure that people know that this, even though there are certain demographics that tend to be more at risk for higher complications, this is a disease that can strike anyone. Next question.
Just kind of a question about rent and landlords.
Question.
Who are foregoing rental income.
Okay.
Bills. How to help.
Question about rent and landlords. So we did pass a sort of eviction defense ordinance that really just provided for basically financial stress due to the coronavirus pandemic to be used as an affirmative defense against eviction, right? So this gives tenants more rights. That was actually subsequently then really ratified by the state of California, passing a similar kind of a declaration from the governor's office. But I do recognize that there are small landlords in Sonoma County who really rely on rental income. First of all, it's important to note that what happened at the state or local level did not actually provide for just a waiver of rent, right? It was really just giving people that opportunity to defend themselves if in fact they couldn't pay rent, that they weren't going to be kicked to the curb in the middle of a pandemic, which I think is really, really critical, not only in terms of public health, but just in terms of humanity. However, the governor also did mention that several banks are actually deferring mortgage payments. And so I think that that's also a critical tool for landlords to know that if they're relying on the rent to pay the mortgage, they actually do have a mortgage deferral. I believe that most of them were for 90 days and that Bank of America was the only one that was for 60 days, because I remember Governor Newsom saying that a few times, like he kind of wanted to stick it to Bank of America. So I can definitely double check that information, but I'm pretty sure that was what it was. It sticks in my mind. I know that there was a question about homeless residents and what what the county is doing right now to assist the homeless. There is actually an entire task force within the Emergency Operations Center solely focused on the needs of our unsheltered. We are looking at it through a few lenses, right? Number one, we're looking at food, we're looking at hand washing stations, and actually the hand washing stations and porta potties were expected to be delivered this past weekend. So I haven't gotten a report yet from the Emergency Operations Center, but I'm hoping that all of those were actually delivered this past weekend. Number two, we are looking at actually renting different motels and hotels in order to provide increased shelter capacity so that people can get off of the streets and into actual, four walls and a roof. It's also important to remember that our existing homeless shelters have had to actually decrease their capacity in order to comply with the public health directives, right? You can't have as many people crammed into a barrack-style shelter because that creates an extreme risk for transmission of the coronavirus. So we're desperately trying to get people, off the street into motels and hotels, and this actually is also going to be providing income for the motels and hotels, a lot of whom are just entirely shut down because they were tourist-based. So we are working very hard to address the needs of our unsheltered population. We're also working with clinicians to ensure that wherever a homeless person is placed, that they are actually followed and provided with medical follow-up to make sure that they're being screened for the coronavirus and receive tests if they need them.
Do you know what the demographic information of the people, the hospitalized, whatever, 13 people who are hospitalized?
This is a great question. So someone asked if I know the demographic information regarding the people who were hospitalized. And I do not have that information, but I'm going to be asking about that tomorrow morning at my emergency operations briefing. We actually shifted to a just 5 days a week emergency operations briefing for the supervisors, and so I didn't actually have it over the weekend. But I remember that from the last round of questions, or maybe it was on social media, but I definitely want to find out what the rates of hospitalizations are in different demographics, and I would love to be able to share that with you.
And is there any sort of follow-up with people who are positive but well enough to be at home, or their contacts to make sure they're following the stay-at-home?
That's a great question. So the question was, is there any follow-up to people when they test positive in terms of for both sort of making sure that they are self-quarantining at home if they do not need to be hospitalized, and then also with respect to their contacts? We are actually stepping up our contact investigation, and so we were having a train the trainer kind of the end of the last week and then early into this week, where we're actually trying to train up a lot of different public health clinicians in order to do this work. And so that means that whenever you get a positive case, you aggressively research where that person has been, who they might have come in contact with, and do a little bit of sleuth work and actually call on a regular basis anyone who came into contact with the infected person. According to Dr. Sundari Mace, our public health officer, this is really how Germany got their COVID-19 sort of pandemic under control in that country, was really through very, very exhaustive contact investigations. And that's something that we are trying to do more of in Sonoma County. And so we expect to see that capacity increase this week to be able to do more of that.
Are we officially shelter in place until May 1st now?
So we are not officially shelter in place until May 1st, but I would anticipate sort of an extension to the order probably forthcoming this week. As we look at, what's happening both at the state level, at the national level, I think everyone recognizes that this is going to take more than just a couple of weeks to get under control. And actually, there's a lot of really interesting historical data about what different cities did during the 1918 pandemic. And when cities, had very, very strict policies and they were able to flatten the curve, then when they loosened them, unfortunately, they would sort of see a surge in cases. And so I think it's really critical that if we are succeeding right now in bending the curve, which preliminary reports from the Bay Area, I've seen various news sources note that we are, that we keep doing that to make sure that our healthcare system is not overwhelmed by COVID-19 cases.
Will Los Guilocos homeless camp still be closed on April 30th?
That's a great question. So someone asked if the Los Guilocos village, the homeless sort of shelter that we set up out at Oakmont, be closed. And I do not think that is going to close. We have a critical need for expanded capacity in our homeless system of care. And that has been a very successful model, just in conversations with the providers out there and also with some of the homeless residents themselves. And so I think it's really critical that if we have people in a stable place in their own dwellings, that we keep them there and that we don't try to move them in the midst of a pandemic, which could create additional transmission risks and certainly would create additional just trauma and stress in the population.
What impact is this having on the county budget?
That's a great question. What impact is this having on the county budget? I will say, are extremely strapped in the county budget right now. We have been through multiple disasters, and each of those disasters took a toll. I would anticipate that we will probably be having to look at dipping into our reserves. I don't have that formally yet, but just based on the cost of response to this pandemic. One of the challenges with FEMA and with federal disaster declarations is that you generally have to front the money and then you get reimbursed later. And FEMA, the process can be extremely slow and it can sometimes take years to receive those reimbursements. So we actually haven't received all of the reimbursements from the wildfires and from the floods. And so that's one of the reasons that our budget is very, very strapped right now. Unfortunately, this will also come at a time when we have a more critical demand for county services than ever before. If we look at flattening the curve, that also lengthens the curve. And so we would expect to see significant economic impacts locally here. A lot of folks who might be in need of eligibility services that the county provides. We are the front door for people who need food stamps, who need job seeking assistance. A lot of the federal programs are, really deployed at the local county level. Other questions?
We saw all the beaches were closed off except for Gleason Beach. Why is everything but that closed?
So a question about why isn't Gleason Beach closed? And all of the beaches, period, should be closed. I worked extensively with state parks and regional parks coordinating over the past week, and there are actually now signs up at all of the different coastal access points that state beaches closed, parks closed, and so hopefully people are abiding by those orders. But I will look into the issue around Gleason Beach and find out if there is some reason that one slipped through the cracks, and definitely follow up on that.
Can there be messaging about not taking whole families out when you're shopping and sending just one person?
This is a great question. So someone asked if there can be messaging about not taking whole families out with shopping, and we actually have been working on a campaign for that at the county. And so if you go to the county's Facebook page, we have a lot of messaging around get in, get out, which is the idea that, you just need to go in the store and get your one item. It is not an opportunity to go window shop. We are also working actually to message to the businesses themselves that if they have an essential service, they are only supposed to be providing that essential service. So for instance, Walmart, right? They have food, they can sell food, but they should not be having the toy aisle open, having all of the clothing open, because that's considered a non-essential service. So great idea. We'll continue to message that. I do want to acknowledge that we do have single parents who may have no other thing that they can do with their children aside from take them to the grocery store. But I do think that if you are lucky like me to have two parents and, kids in the household, that for us, one of us goes and you go to the grocery store and you sanitize everything and you wash your hands when you get home and you follow really good sanitary protocols. But I'll definitely work on trying to get that message out even more widely. Thank you for the suggestion. Next question.
When are the self-test or rapid tests going to be available?
That is a great question. When are the self-test or rapid tests available? I actually was just emailing our public health officer and our director of health services about this, and I have not heard back, but I have heard that there are these new rapid tests that can immediately return results, I think in like 15 minutes or something. And so we are definitely investigating that and looking into the capacity. And my understanding is that whatever company developed that already has a lot of different governments in line trying to get their hands on those tests. So I will definitely let you know as soon as I do when we'll have a more rapid fire testing capacity. I do want to say though that at least our public health lab is returning results in 24 hours. And if it's a priority test, so for instance, a healthcare worker, a first responder, it is usually same day and even within a matter of hours. So we are able to return the results fairly rapidly compared to some of the private labs that take a number of days to return the test results.
What advice can you give for people experiencing anxiety right now?
What advice can I give for people experiencing anxiety right now? Reach out to other people. I know that it's stressful that we can't go out to the regional parks. I know that it's stressful that we feel like we're on the cusp of this, very strange thing and we don't know how long it's going to last or how bad it's going to be in Sonoma County. I know that it's extremely stressful to read the news reports about the really tragic things that are happening in New York City right now. But we're all in this together. And so I think the more that we can check in on each other, just send a text. My kids are going crazy because they really want to see their friends. And so today was the first time that we did Zoom meetings for kids, right? So, my 5-year-old was on Zoom and my 7-year-old was on FaceTime. So stay connected with people, right? Reach out and talk to your friends. And we do have mental health services and support if you need it. So you can call 211. They can connect you to different services. So there is help. Please make sure you know that you're not alone and that you've got friends and you've got a community that cares, and you can also get professional help if that is what is required.
Somebody says, is County Roads working during the shutdown?
Is County Roads working during the shutdown? County Roads maintenance is an essential business, and so yes, if there are things that absolutely need to be done in order to keep a road safe, let me know and we can get on that. I think that they're working on really sort of trying to triage the most important things, just again to minimize the transmission risk in the community and in the workforce. And it's scrolling through the sorry for the pause. There's a lot of, I think, comments, and he's trying to find the next question.
I've already answered this. When will there be more swabs to increase testing?
The question is, when will there be more swabs to increase testing? And actually, I did hear that we are hoping within the next few days to secure additional swab supplies. So fingers crossed that those comes through. It's it's always kind of what's the saying? A bird in hand is better than a bird in the bush. But we've been told that they're coming, and hopefully that will follow through. So hopefully that will really expand our testing capacity. And as I think I mentioned last week, we are looking at doing proactive surveillance testing. So that was what we did, a few weeks back, actually earlier on in the testing process, where we would actually go out and proactively test people. That's how we found some of those first cases of community transmission in Sonoma County. We're looking at doing that again, but focusing on high-risk populations. So health care workers, making sure that, we're not seeing transmission occur in the jail, for instance, where it could really transmit very quickly. So that would mean testing not just symptomatic carriers, but also asymptomatic people, again, that would be in a high-risk profession or a place where there would be a lot of different contacts.
Are all construction home improvement activities considered essential?
Are all construction home improvement activities considered essential? That is a great question. In general, residential construction is considered essential because shelter is essential. Also, in order to keep people safe, right, you need to have access to plumbers, electricians, and folks who can fix things that are broken in your house in order to keep your home habitable. So in general, residential construction is considered an essential business per the county health order. All right, we'll do maybe a couple more questions and then wrap it up, and I will try to answer any questions that we miss via social media.
Mostly duplicate.
All right, Emmett's saying that most of them are probably duplicates. Got any other last questions? All right. Well, if we missed, I will be here again. Actually, I think Tuesday night is the virtual town hall from the county, so I will see you again Thursday night. And in the meantime, I'm always available via email, which is linda.hopkins@sonoma-county.org. You can also find me on social media on this page or on my personal page, and I look forward to answering any questions that you might have to the best of my ability. I'm going to follow up on those items that you guys, that I didn't quite have the answers to. So reusable grocery bags, hand sanitizer availability in Sonoma County, why Gleason Beach is open when the other beaches are closed, and then also make sure that we're upping the messaging around what is safe shopping, which really means get in, get out, just send a single person if you can from one household, and don't bring the whole family. So take care, everyone, stay safe and be well. We're gonna get through this together, and I will try to be here to give you as much information as I can in real time. Have a good night.